In this video, we're taking a look at emergency department access. So in the upper left-hand corner, you can see the map of the United States that's color-coded, where the darker shades of blue represents those states that have a higher number of hospitals, and the lighter shades of blue represent those states with lower numbers of hospital. And if you put your cursor over any one state, you can see for the state of California, there are 369 distinct hospitals there. And if we select a lighter shade of blue, such as North Dakota, we can see that North Dakota has a distinct count of hospitals at 46. Now off to the right here, we can see a listing in descending order for each of the counties and the number of hospitals that are in those counties. And you can see, put your cursor over that, and it's going to tell you the county, the state that county's in, the population type, and the distinct count of hospitals within that county. Now, population type, you can see over here are the listings of the different population type. So in blue, which represent metro, metros are going to have a population of 50,000 or more people. The non-metro cities, indicated in orange, are going to be populations between 2,500 but less than 50,000 people. The non-metro towns, these are going to have populations that are less than 2,500 and are represented in red. So if we scroll down a little bit, we can see some of the measures that we have for this dashboard. Looking at the state uninsured rate, right now this is for all 50 states. The different hospital types, so acute care hospitals, children's hospitals, critical access hospitals, and psychiatric hospitals. And then the measures for quality, for seeing how many minutes the patient is at the emergency department before they leave. Now there's a couple filters that we can do. First of all, we can, rather than looking across the country, we could select maybe a specific state. So let's select Georgia. So if we select Georgia, we can see all of the counties in Georgia listed in descending order by the number of hospitals within that county. And also shows down here the uninsured rate and then the distinct count of hospitals and the median measure scores, all specific to the state of Georgia. So we could do that for any state. And if we select Georgia again, that's going to bring us back to the United States, all 50 states. And then we can also select different population types. So if we want to take a look at only non-metro cities, we can select non-metro cities. And then the dashboard will refresh and we'll see only those counties that are identified as non-metro cities. And again, here we have these listed in descending order. And then our measures at the bottom are for only non-metro cities. But we can combine that with, let's go back to Georgia again, and now we're looking at only non-metro cities within the state of Georgia. So we can put our filters together to narrow this down. Selecting on the state again allows us to see all 50 states, and selecting all from our population type brings us back to all population types. The final filter that we have is the hospital type. We can select the type of hospitals that we're going to want to look at. So let's say we want to take a look at only acute care hospitals. So if we select that, and now the data is going to be filtered to only include acute care hospitals, and we can see the number of acute care hospitals in each of the counties across the United States, as well as the specific measures for acute care hospitals. And then we can bring this back to look at all hospital types. There we go. So that's what you can do with this dashboard. Again, this is emergency department access, and you can take a look at this by filtering population type, hospital types, or any state.